So in our practice, the primary use of the PillCam colon is going to be for the patient who has incomplete colonoscopy. We have a group of very experienced gastroenterologists, so the rate of incomplete colonoscopies is low, but we're a very high volume center, and we've got a lot of people doing colonoscopy. So we anticipate that there's going to be a real demand for this. And although there are occasional cases, we look at this as a really good way to evaluate the portion of the colon that we haven't seen. PillCam is going to be a good option. First of all, for those of us who are endoscopists and who are setting out initially to get endoscopic images that are similar to colonoscopy, really the only way we can do it is with the PillCam. So far, in the data that we've seen, it's done extremely well in terms of being able to examine the portion of the colon that's not reached. And in really the only comparative study with CT colonography, which was recently reported at DDW, it actually outperforms CT colonography in terms of its ability to find polyps in that portion of the colon that hasn't been reached. I think it's also going to be attractive for gastroenterologists to utilize a test that allows the patient to stay within the GI endoscopic system, and for easy follow-up in that regard. I think it'll be a very attractive way to evaluate the colon in patients who have an incomplete colonoscopy. So the advantages of it, I think, compared to radiographic tests, first of all, again, it doesn't involve the use of radiation, and that's attractive to some patients and to some physicians depending on the clinical situation and the age of the patient. It's certainly very comfortable for patients, double contrast barium enema, because it involves distension of the colon. Rolling the patient around actually can be associated with a significant amount of discomfort. CT colonography, because of distension, is associated with some discomfort. That may be particularly attractive. I think many patients will perceive PillCam colon as being less invasive than the two radiographic tests.